Good morning, ladies and gentlemen. Firstly, I would like to thank the Pakistan Nuclear Medicine Society for giving me this opportunity to talk on this topic of setting up a Theragnostic unit. My name is Gopinath. I'm based at the Royal Free Hospital in London. And for the next probably 20 to 25 minutes, I'll be taking through how to set up a Theragnostic unit and what are the challenges and some take-home messages. Coming to radionuclide therapies and nuclear medicine, we treat a variety of benign and malignant conditions. For example, benign thyroid disease and radiosinuectomy for joints, and also malignant scenarios like neuroendocrine tumors, liver cancer, thyroid cancer, prostate cancer, and also bone palliation. And then you might ask a question, we are all doing all these things, and why there is a rebranding into a new topic called as Theragnostics. I personally feel it's a rebranding, but rebranding in a nice way so that the delivery of the service is more structured. And we also have a lot of questions like we have a small department, can we do Theragnostics? And how can we convince our oncologist? And staffing is a problem, and how can we increase the referral patterns? And how much will it cost to set up a new Theragnostic unit? Do I require an in-house radiopharmacy? And what to include in the business plan? And where can I get sufficient training to deliver a quality service? Well, let me take you through what are the challenges and how we can come over the challenges. Clinical use of radiotheragnostics is complex. Logistic and regulatory hurdles can be a major problem. And again, well-trained physicians, medical physicists, nurses, and radiopharmacists should be available to ensure patient safety and best outcome. Coming to starting a Theragnostics unit, you need to have a clearly defined roles within a team, which is mandatory. And diagnosis, drug prescription, radiation safety, follow-up should be clearly specified in your standard operating procedures. And also the success will depend on specific attention to education and training of the existing workforce, because you have a two group of workforce which is already practicing nuclear medicine and some are in the training scenario. So we have to cater both groups so that we lead positively into the future. Why do you think you need a Theragnostic unit? And of course, cancer is an integrated service. Theragnostics leads to precision medicine, means to say visualization is a key to treatment and monitoring. And again, fusion of diagnostics and therapeutics might improve the future of cancer care. However, who are the core clinical members you need if at all you want to set up? It is exactly like your multidisciplinary meetings. You need a nuclear medicine physician, an oncologist, a radiotherapy surgeons, nurses, pathologists, radiologists, and various other groups which we'll discuss as we go on in this talk. So these are the main core clinical people we should require if you want to start the Theragnostic unit. And why should we involve a clinical team or oncologist? I've been trained in nuclear medicine and I've been trained in therapies, and why I need to liaise with the oncologist? In fact, oncologists refer patients to you, therefore you have to be good to them. And you have to discuss with them for every scenario, and therefore you can provide an effective service, because you are not the last man standing, though in some scenarios you are. But only thing is coordinated work helps in setting up a better unit. We should allow oncologists to treat what they see and also see what they treat. Therefore, they become more confident in what we are discussing, and what are the implications of sending a patient to a nuclear medicine department. And also understanding the principles of imaging and drug delivery process might help the oncologist to appreciate the science and principles behind nuclear medicine Theragnostics. And finally, better understanding leads to better patient selection and realistic expectations, not only from you, not only from the oncologist, and also from the patient. Why should and who should lead the team? That's a very interesting component, and because I think it should be a nuclear medicine physician, for a simple reason that we understand the science and practice of nuclear medicine. We have been trained in radionuclide therapies and radiation protection, radiobiology, local logistics, and as well as regulations. But again, the world is changing. In fact, your competition will be radiation oncologists who are also trained in similar aspects, and they understand radiation protection, radiobiology, and regulation logistics. Therefore, they will be your main competitors in the world of Theragnostics. Nuclear medicine team members in a Theragnostic setup should be a nuclear medicine physician. You should have involved technologists, nurses, radiopharmacists, and physicists, and have a contingency plan and who will do what, and therefore we can be effective and spend quality time in developing a good unit. And of course, even though they might have talents and everything, you need to have passion and dedication to bring your dream into reality. So you have to have passion and dedication. There is no shortcuts. Non-nuclear medicine team in a diagnostics unit, you need oncologist, you need pathologist, you need research and development team, you need surgeons, and you need industry. Industry will play a significant role if you interact them in a right way. Advantages of diagnostics is you make a personalized decision about treating a patient or scanning a patient. Personalized treatment response is also important. Personalized prediction of toxicities and dosimetry also plays an important role. Therefore, these are the three main parameters where you'll be looking in terms of diagnostics. And also you have a better prognostication because you tailor the treatment according to the patient needs. And also you combine different radio tracers and to get the maximum benefit. And the world of oncology is moving to a combination therapies, not only within nuclear medicine, outside nuclear medicine. Better assessment of biological behavior and tumor heterogeneity, because it is not a single tracer is going to give you all the answers. Again, nuclear medicine is moving into a domain where you use multiple tracers to get better patient selection and outcome, and possibly reduction in cost and limit unnecessary interventions. But again, you need to understand every major therapy is expensive. Limitations of diagnostics. Of course, there is a problem in terms of variable sensitivity and specificity to radio imaging techniques depending on the tracer, on the scanners, and availability. And specificity of diagnostic, what you call a therapeutic component of diagnostic spares are not perfect or nearly perfect as of now, except for a few treatment types. Response assessment is not perfect, and still it is evolving, but there's no single way you can predict the patient response. Technology availability around the world is not uniform, and within a town it is not uniform, and how can I expect it to be uniform around the world? Regulatory approvals and logistic varies and from country to country, and the techniques you use. And financial sustainability is effective, and it is challenging to get funding to provide a well-defined diagnostic unit. And training, of course, is a major challenge, and it is not uniform within the country as well as in various parts of the world. Which areas we should focus and strengthen to develop and run a successful diagnostics service? I think I'll give the first chances to training and quality of workforce. Meet the needs of the referrers is paramount important. Collaboration with the clinical team is also very important. Meeting the needs and desires of patient is another factor we need to take into consideration. And finally, funding and budget. Excellence always comes with cost, and therefore we need to have a short and a long-term plans, how effective and how to convince the funding authorities to support your dream of a diagnostic unit. Is diagnostics cost effective? As I said before, better cancer care will always be expensive, irrespective anywhere in the world. Local internal cost, what are the factors is you need to have an established dedicated diagnostic facilities, and you need passion and commitment, as I said before. And who's going to pay for the initial capital investment, infrastructural development, whether you want to rebuild a new department or you're going to start from the scratch. External cost is rare compounds used in the treatment, and also availability and commercial production, and a specialist staff to do specialist work also will play an important role. What are the internal challenges you will come across is the problem is everybody wants to do everything. Everybody wants to be the director. Everybody wants to be the lead. And then who's going to do the work, my dear friends? Who should lead the service? Who should do the therapy? Is it the nuclear medicine physician, or the oncologist, or the radiologist? And also a cost to build or expand the department also plays a major component. Training requirements and how much are we going to get trained, and how far, and what are the types of therapies you're going to do and where you're going to go. And these are the factors which will come into play when you start thinking of training requirements. And competency, and how you're going to provide competency, because again I said there are two factors. One is already trained nuclear medicine physicians who have already been competent to train, as well as treat. And now we are starting, if you're going to challenge them in the question of competency, it's going to be challenging. So the competency has to be at two levels. One, for people who are already trained in nuclear medicine, and also and that there will be a different level of competency required for people who are getting into the training scheme or already in the training scheme. Coming to what are the external challenges is it's technical, shortage of interdisciplinary teams. Again, you need to have standardized and efficient protocols to provide efficient service. You need to bridge and build interdisciplinary boundaries and cross the boundaries and build relationships. That's the most important thing. And restricted availability of radioisotopes and regulatory challenges. Again, I keep repeating all these things because these are the things will catch you at every stage. Economic is high developmental cost, and reimbursement policies quite ill-defined, and there's no adequate funds for research. And also, we always think we are very passionate and we always say nuclear medicine is growing, but we don't look around and say that there are competing modalities and techniques and they are as good as any of your PSMA or any of your PRRT treatments. Okay, everything is growing around you, including yourself. So when you are so much happy and thrilled, you should also look around and see that everything around you is also growing. So you need to be quite careful and realistic in your dreams. And also there is a global inequality and differences, and therefore everything is not going to come very easily. Coming to the biochemical components, you have limited drugs, and large-scale production is challenging, and combination therapies are not explored, but it is coming. Whether you like it or not, the world is going into terms of combination therapies within nuclear medicine using different tracers and different isotopes, and also combination therapies is combination of immunotherapy and chemotherapy along with nuclear medicine procedures. What should be the role of industry? Industry, actually, they are very keen and they're very supportive, but you need to ask for specific things. You need to ask them to support training and support clinical meetings like this. Develop educational material in collaboration with good teams, and also ask them to support large multicentric or multi-departmental trials to convince the regulatory authorities that this treatment, and the funding authorities also to tell them that this treatment is working, and we need to come with a game plan to give the best for our patients. Education and training, this is quite variable. If you see around the globe, in USA, there are multiple ways of entering into nuclear medicine. It's a 3-year program with the AACGME, and United Kingdom, we have a 6-year training program. 3 years is dedicated to radiology, where they get an FRCR, and following which they come 3 years into nuclear medicine training. And India, training is about 2 to 3 years, and in Pakistan, again, you have 4 to 5 years training, including FCPS. And China, the training varies, but more or less it is very heterogeneous. And I feel proud that of all the training systems and training mechanisms I've seen around the world, I think so India and Pakistan does the best training programs. And not only doing training programs, they're effective in teaching, and that's the most important things. And you can have a fantastic curriculum, but I feel 80% of the terms and places I visited, there's quite a lot of challenging aspects in delivering that curriculum. So I think you should be proud about Pakistan training scheme. It's quite effective and it's a very good training scheme. And coming to the target groups, you need to target not only nuclear medicine physicians, you have to train oncologists, nurses, and nuclear medicine physicists, and radiopharmacists and technologists to provide an effective theragnostic unit. And again, firstly, before even if you go for a qualification or competency assessor, all people who are interested should have some sort of passion for theragnostics. And the qualified should be like a level 2 training system for people who already are practicing as consultants, physicians, and oncologists. And in training, it should be as gratified as level 1. The training system has to be more stricter, stringent, and more elaborate when compared to people who are already qualified. Are there any study material? There are excellent study material available around the globe, and ENM radionuclide therapy guidelines are very good as a starting mechanism. It's freely available at the ENM website. You can go and read them. And then SNM also has got very good guidelines, and nowadays ENM and SNM jointly do a joint guideline so that they can discuss various things in a specific equal platform rather than confusing the audience. IAEA has got a phenomenal amount of radionuclide therapy section. Ladies and gentlemen, please visit IAEA website. There is extensive. They make quite a lot of effort in doing all these books, and it is freely available. and that is more than sufficient for you people to get accustomed and train with radionuclide therapies. And finally, the European School of Multimodality Imaging and Therapy. It's a very excellent website which contains quite a lot of material related both to diagnosis and treatment aspects in nuclear medicine. And of course, there is a fee of 30 euros per year to use the website. And finally, we developed quite a lot of free webinars at the radionuclide therapy webinar series, as well as there is a PET-CT webinar series. All you need to do is to get into the British Institute of Radiology website, log in, register yourself, and it's open access and free. And after finishing each module or each lecture, you will get a CPD point. But there is everything related to PET-CT, cancer types, and as well as different types of radionuclide therapies. Coming to courses and certification, as I said before, you need to have a set criteria in terms of target groups and what are the early requirements, learning outcomes, course content, and how you're going to assess. This is all, it's going to be challenging, but it is possible if like-minded people sit in a face-to-face manner and discuss what has to be done to improve the effective improvement of Theragnostic service in Pakistan. It can be done. It's very easy. All you need is 4 to 5 people with like-minded attitude, and they can do phenomenal work. What areas to cover? Well, again, you have to cover a subject-centered, which will be radionuclide therapy service. It has to be learner-centered, so you need to have a self-assessment modules before they take up a formal certification. And it has to be problem-centered, because in the past and also in the current scenario, often we see one, do one is a philosophy, but that's a very bad way of learning any technique for that matter. So you need to have clinical scenarios, challenging scenarios, and also straightforward scenarios, so that you can come across every aspect of managing different types of patients. So it should not be number-based. Topics to be covered in the training: you have to talk about general oncology and practice. Theragnostics is not just doing radionuclide therapy procedures, my dear friends. Please get out of it. You have to understand the principles of nuclear, just general oncology, radiation oncology, and you need to have a treatment planning techniques and advantages, limitations of all techniques, including radiation or chemotherapy, what are the side effects they see, how they manage. And we often learn quite a lot of things, and so we can integrate systematically in our practice, and also understanding tumor biology, and that leads to what is called as a multimodality cancer care. This is very important, and if you could cover all these things, it'll take time. It's not going to come back so easily. It's not going to we can't establish all these things in a single step or a single phase manner. It has to be a multi-phase. So we need to think what is to be done first, and firstly you need to recognize sites who are doing multiple therapies and all sorts of things, which would have been better if I was there to discuss all these things in face-to-face. Unfortunately, I couldn't make it to this meeting. What should be the training certification based on? People should demonstrate knowledge and experience in science and practice of molecular radiotherapy, visit to a dedicated site, direct mentored experience in the procedure, prescribed procedure types, and also details of multidisciplinary team participation. That's vital in terms of patient selection as well as management. Knowledge of proposed patient pathway, which plays an important role, and you need to have a significant clear-cut checklist so that you can select the patients appropriately and also prepare the patients appropriately before the treatment. And completion of appropriate theoretical training courses, and you need to have specific aims and details of this course, and also the scope of the training course with assessment. Ideal fellowship should be approximately about 3 to 12 months, but it's very difficult who's going to fund and who's going to sponsor it. But again, we can have various types of webinars or face-to-face lectures. We can have a therapy-based masterclass. We can have didactic lectures, tutorials, and practical workshops. It's all become a combination which can be included in your current curriculum, or you can have an extended 6-month additional curriculum to learn the science and practice of theragnostics. What should national societies focus on? You need to have dedicated committees and dedicated people to promote, create awareness among the clinicians, collaborate and build bridges in relevant cancer societies, training people to meet the increasing demands, continuous medical education, select dedicated team, never compromise on quality. Okay, so when you select the team, go for the best available people rather than your best friends. And best friends are very good. You can go have a coffee, have a dinner. That's okay with them. But when it comes to work, we need professional people who act professionally, and therefore we can achieve something together for the Nuclear Medicine Society of Pakistan or any other country for that matter. Role of international societies is to develop realistic core curriculum, invest in value-based educational material. Again, this goes to, you bring in the best of the people to deliver the best of the lectures. So don't go by friends. Friends are good to support your dream, but if you want to do high quality work, you need to be unbiased. Develop practical guidelines and simplified standard operating procedures, and also develop universal pre-treatment checklists which can be used nationally. Okay, if a patient for thyroid benign treatment comes, this is a basic checklist, a minimum criteria checklist, or a minimum points you need to do, whether if it's coming for cancer therapy or for benign therapies. This helps in terms of uniform patient selection and management, and therefore it is easier for us to implement this into our clinical practice. Should we have a Theragnostics Academy? Yes, the answer is yes, yes, yes. And because the demand is growing and there is limited structure facilities, training facilities, limited training centers, and standardized requirement for training is important. Standardized certification and quality. If we could get all these things done, I think everybody will be ready to have a Theragnostics Academy. Current limitations, as I said, the curriculum is well designed, but the delivery is variable and it is not structured. Supervisors with limited experience and interest in radionuclide therapies, and the training is basically number-based, not the scenario-based or competency, or it has to be challenging. And successful Theragnostic service, dream or reality if you recognize the strengths and limitations, inclusiveness with trusted partnership, think big, no shortcuts, be realistic. Be realistic and try to start with smaller therapies which are more cost effective and build up over a period of time, maybe in a 2 to 3 years time. You will be realistic in doing the best for your society. Theragnostics is fascinating. Results are positive but are evolving. Long-term safety studies are required. Moving to combination therapies will be a reality and soon. You need multidisciplinary expertise. Training is important, and you need to have smoothing collaboration with industry. Limited or no well-defined community of stakeholders. Therefore, you have to claim that you will be providing a good to the society. And the challenging aspects are the expertise in radiochemistry, radiobiology, oncology, pharmacology, medical physics, radionuclide imaging, and dosimetry. We need to develop a new group of people so that they can take this forward. And as I said, there is significant room for improvement from the global perspective. And the next question is, what can Pakistan do for Pakistan? Pakistan has, and what Pakistan needs, and what Pakistan should do. So as far as I'm concerned, you have excellent faculty, excellent trainees, and I've worked with them all over and I interact with them very often. They are very smart and they're very dedicated and very focused. So what Pakistan is missing is, I want to be very clear, though I must have taken 2-3 minutes more than what I'm supposed to, is you need to have an annual radionuclide theragnostic workshop or a masterclass. That's how we're going to do it. Okay, you need to select a site performing more than one type of radionuclide therapy. The course can be cancer-based or therapy-based and involve nuclear medicine and other allied specialties. Maximum delegate should be 30, I would prefer, but even if you want to expand, go for 40. Don't do a meeting with 100 and 200 people. That is a national congress. Like this, you come here, you meet people, you interact, you learn something and go. But if you want to do a specific thematic meetings, it has to be small so that over a period of time, you can learn from it and also train many, many groups in that. Therefore, the course will continue for more than 1 year. And most important thing is what I can do for Pakistan. I've been talking that everybody must have spoken to you, but I can help Pakistan to do these things as an individual. I can help, I can interact because I got a lot of friends in Pakistan. We should start this. And before even going up to the Theragnostics, I feel that Pakistan should have an annual PET-CT course. An annual PET-CT course, again, you select PET site facilities who do quite a lot of volume. And again, the course can be cancer-based or thematic, involve nuclear medicine, physician, and other allied specialties. Again, yearly have 30 delegates. 30 delegates, high-level course, you interact, You have faculty of Pakistan residents who have gone abroad and working as consultants all over the world. I'm happy to support, and we can select some local speakers and local faculty. By end of 3 years, we should have a well-established faculty to run this course annually, because PET is going to be part and parcel of nuclear medicine. It is going to grow exponentially. There's no doubt about it. The major challenge everybody is facing is number of PET reporters and the technologist. So therefore, we can effectively contribute by having a high quality PET-CT course. And as I said, I know a lot of you, and if you're interested and if you want my help, I'm more than happy to set up the curriculum and the training course and be there for the first 1 or 2 courses. And after that, I think people should run. We have started this in few countries, and it is exceptionally amazing and successful. But as long as you keep the number of people small, okay, we'll treat everybody in high quality standards, 30 to 40 people maximum. Do it annually, and Pakistan will be shining in nuclear medicine as of now, but it'll be more stronger and more effective for a long-term aspects. So I wish the Pakistan Nuclear Medicine Society an amazing future, and I'm more than happy to be part of your dream and part of your future. Finally, thanks to my mentors, because I learned quite a lot of things about them. So whatever good I'm doing is because of them. And also, thank you all for giving me this opportunity. I hope you enjoyed this talk. It would have been more effective if I was here face to face, looking at your eyes. And I, to my friends in Pakistan, hope to meet you all soon in person. Thank you. Good luck.